Nowadays, patients can get straight teeth through the mail in many cases, or by coming in and getting just clear aligners to line up your teeth. However, we have to look just beyond the straight teeth. If only the purpose of orthodontics is to straighten teeth, we've missed the boat. There are other bigger underlying issues. Is there enough space for teeth? Do we need to expand the jaw to make the teeth be able to fit in the arch? Are there bite issues? Are there joint concerns? What we are doing to the teeth and the face is going to impact more than just how we look. It's going to potentially impact airway, joint position, facial aesthetics. These are all the things that we have to look at. I have made a decision and drawn a line in the sand that I don't extract permanent teeth for orthodontic purposes because I'm concerned that it could lead to a smaller airway, which leads to a narrower palate. I'm concerned that it could affect the facial profile. I'm concerned that our temporomandibular joint, TMJ, could go into a less than ideal position as well. I don't know, and I'm concerned, and so I want to make sure that everything is as healthy and into the best possible position. I often have patients come in and tell me they have TMJ. What they really mean to say is that they have TMD. TMJ means temporomandibular joints. We all have two of those. TMD is temporomandibular disorder. What I'm hoping for my patients to tell me is when they're having pain, what kind of problems are they having? Headaches, pain with chewing, opening, pain in their ears. These are all common symptoms. Headaches, migraines, any kind of pain in the face or neck. This is not something that patients should have to live with. This is something that can be treated, can be eliminated or significantly reduced to improve their quality of life so that you can get back to being the person that you are inside in a pain-free place. So the benefits of nasal breathing, beyond just what we normally associate with filtering and humidifying air, is, believe it or not, we actually get more oxygen uptake by doing that. But even more important, it allows proper facial growth and development. As we're breathing through our nose, we're able to keep our lips sealed, our tongue to the roof of the mouth, which encourages proper facial growth and development to allow the face to grow as forward and wide as it's supposed to encourage the proper airway size. And then as we're able to breathe better both during the day and while sleeping, that encourages proper development and growth of the rest of the body as well. Oftentimes when I see children come in who are obvious mouth breathers, I oftentimes start asking moms a lot of questions about how is their child's health and what's going on at home. And moms are like, how did you know that about my child? I never would have told you about that. And it's because these symptoms are oftentimes related to mouth breathing, inability to breathe either during the day, inability to breathe at night, that can be leading to longer term health problems associated with breathing through their mouth in comparison to breathing through their nose. The primary reasons moms should be paying attention to a potential tongue tie is nursing and breastfeeding issues. After we get past that though, the next time we can typically see problems is in the transition to solid foods. Oftentimes I hear mom report that their children are choking, gagging, inability to progress to age-appropriate solids, or they can only do purees, they can't do really textured foods. Moms tell me that their children are turning blue when they're eating. So if they can't move food around, they're not going to be able to eat properly. Could it be related to an untreated tongue tie because they can't move their tongue into the proper position to make all of the sounds? Myofunctional therapy to me helps address why the face grew the way it did. We have to not just correct unfavorable growth that's happened, but we have to fix the underlying reason why it grew the way it did. Myofunctional therapy allows me to work with kids and to address the muscles, the lip seal, the tongue to the roof of the mouth, nasal breathing, posture, habits. Are we sucking on our thumbs, our fingers? Do we have our mouth hanging open? Do we have weak and low muscle tone that has allowed the face to grow unfavorably? Myofunctional therapy is what makes my treatment stable in the long term and helps kids be healthier. Many times when I have adults come in to talk to me about orthodontic treatment for a second time, they're talking to me about more than just straight teeth. Many of my adult patients have had permanent teeth taken out and they feel like their mouth is now too small. They feel like their tongue can't live in their mouth. They feel like their face is compressed and their jaw is out of position. These patients are oftentimes talking to me about, can we reopen the spaces where they had teeth pulled out, because they don't feel like their face is either the look of what it was before treatment, or they don't feel like their tongue can be in the right position and they're just not who they want to be. Redeveloping their face and structure to where it was before, we can help them achieve their health, wellness, and aesthetic goals. Sleep disordered breathing can be any number of problems that happen to us while we're sleeping. Most people are familiar with either snoring or sleep apnea. Sleep apnea is when our airway collapses or partially collapses while we are sleeping and deprives us of oxygen while we are sleeping. This sends our body into a panic state, and our brain tells our heart, you have to pump faster and you have to pump harder, which can raise your blood pressure, which can lead to a higher incidence of stroke. It can make it so that we're not feeling rested when we wake up in the morning. Some patients will tell me I can sleep 4 hours, 6 hours, 10 hours. I'm always exhausted because they're not getting restful sleep. So by treating apnea, we can both make you healthier and feel better at the same time.